Hi guys, welcome back to my channel. We're moving ahead with our 20th notebook series, and the topic that we're doing today is the most volatile and the most important topic as well, which is anesthetic drugs, right? So today we'll be covering the induction agents, then inhalational agents, followed by muscle relaxants and local anesthetics. So let us begin the discussion. Our first topic are induction agents. Right? So in induction agent, the first drug that we're doing is thiopentone. Right. So now what do you need to remember regarding thiopentone is first that it is also called as truth serum. Right? The dose is 3 to 5 milligram per kg. It is stored in it is a yellow amorphous powder, right? And it has a garlic odor. The pH is 10.5, that is, it is alkaline, right? And the shelf life is 2 weeks. Now, very important to remember is that the onset of anesthesia, it begins in less than 30 seconds. The duration is for 10 minutes. Right? T-half is 10 hours. Right? Why? Because of redistribution. Then it metabolizes in the liver, right, by oxidative deamination. And excretion partly is also due to kidney. Then what are the effects you need to remember is that in CNS, it reduces the intracranial pressure and the oxygen consumption, and it is also anti-epileptic. In heart, it decreases heart rate and BP, right? It releases histamine, therefore it leads to bronchospasm. Then there is a property called as double apnea, right? If that happens, then all you have to do is treat it with IPPV, that is intermittent positive pressure ventilation with bag and mask. Then other effects are that it is an antithyroid. It causes fetal depression, and since remember in brain it was causing decrease in intracranial pressure, it also causes decrease in intraocular pressure in the eye. Okay, so it is majorly causing decreasing wale actions like decreasing ICP in the brain, right? Brain may decrease, heart may it is decreasing, lungs may also it is decreasing what? The diameter, that it is causing bronchospasm or bronchoconstriction. Then it also causes apnea, because if it is causing bronchoconstriction, then how will you breathe? And then in thyroid, what is it? It is an antithyroid. Okay, so these are all the functions. The next very important thing you need to know are the indications, right? It is used in status epilepticus. We all know because it is an anti-epileptic, and also it is also helpful for providing therapeutic coma, right? Then it is ideal for neurosurgery. It is used in head injury patients, right? Why? Because in head injury patients, remember that there is Cushing reflex, right? Where what happens is that there is increased BP, decreased heart rate, abnormal respiration. Why this happened? It is due to increased ICP or increased intracranial pressure. We read thiopentone means all is decreasing. So what will it do? It will reduce ICP. Hence, this is the drug of choice in neurosurgery patient. This is one point that you should remember and never forget. Okay, so what we learned? Thiopentone, head and neck RTA. This is the drug of choice. All right. Then next it can be that's it. Then next we'll read about its contraindications. It is contraindicated in porphyria because it stimulates delta aminolavulinic acid synthetase, right? And just remember that it is safe in two porphyrias, which is it is safe in PCT, that is porphyria cutanea tarda, while in AIP and VP it is contraindicated. Let us see if we can remember this. So we are doing thiopentone. contraindicated in AIP, acute intermittent porphyria and variegated, and safe in PCT. ठीक है, तो porphyria cutanea tarda PCT is containing T, ठीक है, and this is also T. So T को T में we can give it. So thiopentone can be given in PCT while AIP and VP इसमें नहीं देते हैं, ठीक है, मतलब it is not given in porphyrias but it is safe in cutaneous tarda, right? Then termination of action is due to redistribution, and if it is given intravenous then it leads to gangrene, right? Also remember it is safe in malignant hyperthermia. Very important point again, it can be given, matlab it does not precipitate malignant hyperthermia. This is all you need to know about thiopentone or truth serum. Next drug that we'll be doing is propofol. This is also a very important drug, and a lot of questions are asked from propofol, right? So let us just write the important points. It is white milky, ठीक है, तो if you have test tubes then propofol will be white milky fluid, and thiopentone is what? This is a yellow amorphous powder, ठीक है. Then the vehicle for propofol is soybean oil, and therefore it will cause pain in injection, this due to soybean oil. It also contains glycerol and it is also alkaline. Then what you need to know is that its T half is 2 hours, not that important point. It is also metabolized by the liver and some part by kidney as well. Now functions, okay, let us compare it with thiopentone. So in CNS, it also causes decrease in ICP, like that. It causes decrease in CMR. Then it is an anticonvulsant like thiopentone. One thing that is additional is that it is also an antioxidant, okay. Now for heart, it decreases the heart rate and BP. So this is also decreasing till now everything, right? And it decreases intraocular pressure better than propofol. Hence it is the drug of choice for ocular surgery. Drug of choice, ocular surgery. Okay. It causes maximum depression of airway reflexes, and this is an important point. It can treat laryngospasm. Thiopentone was causing bronchoconstriction, while this will relieve laryngospasm, right? Because it causes depression of airway reflexes. It also leads to apnea, right? Other are propofol infusion syndrome. And remember one thing, that it is also antiemetic and antipruritic. So it is the drug of choice for what cases? First is porphyria. Now thio was contraindicated of porphyria, while propofol, P for propofol, P for porphyria. So it will be drug of choice for porphyria as well. So one is ocular surgery, second is porphyria. Third is malignant hypertension, because it is also safe in malignant hypertension, right? It is also the drug of choice in daycare surgery. Daycare surgery, because in daycare surgery we need those anesthetic agents that are quick, that have a quick onset and a quick reversal, right? So that is why we'll give propofol, because it has a very short half-life, that is 2 hours. And then it can also be given with LMA, like laryngeal mask airways. While doing LMA intubation, it is again the drug of choice, and it is the drug of choice for TIVA, that is total intravenous anesthesia. Okay, TIVA may remember what we give is remifentanil or alfentanil, that is an opioid with a mixture of propofol, right? This is total intravenous anesthesia. तो क्या क्या हो गया इसके अलावा? डे केयर सर्जरी में आ गया LMA इंट्यूबेशन, टोटल इंट्रावीनस एनेस्थीसिया. Then malignant hypertension, also daycare surgery or endoscopic procedure is also a daycare procedure, so it can be used, right? And remember, propofol is the most common anesthetic agent that is used in the CNS surgery. Okay, if they ask that which is a drug of choice in to reduce the cranial pressure, then the answer will be thiopentone. But if they ask the most common induction agent used in a CNS surgery, then the answer will change to propofol, right? Also, it is the drug of choice in ocular surgery. Then, what else? It can cause anaphylaxis in children less than 3 years, hence it is not given, right? It decreases the risk of post-operative nausea and vomitive, because remember, it is an antipruritic and it causes deep sedation. So propofol is best. Okay, I remember if you want to mark an option and you don't know anything, then the best thing is to mark propofol, है ना? Because generally propofol is the answer in maximum number of cases. But that is not always true. They can ask you any other questions as well. But a safe bet or a safe guess would be propofol. Then next is ketamine, right? What you need to know with ketamine is that it causes dissociative anesthesia. The dose is 3 to 6 milligram per kg. Okay, ketamine. This is the third. Right? It is a phencyclidine derivative, so it will cause delirium and hallucinations, right? Therefore, with ketamine, we always add midazolam, right? And remember, the dissociation it causes, it's at thalamocortical junction, like between the cortex. This is the cortex and this is the thalamus. Okay? So at thalamocortical junction, there is dissociation, right? It is excitatory for NMDA receptors. It stimulates NMDA receptors, right? And its racemic mixture is less psychotropic. So what does it cause? Like till now we have read that all these thiopentone, propofol, they were causing decrease in ICP, decrease in heart rate and BP. This is just opposite. It is just increase ketamine. So it will cause increase in ICP, increase in heart rate, increase in BP, then bronchodilator, increase in respiratory rate, right? And it causes the least depression of airway reflexes, right? The laryngeal and the pharyngeal reflex will be present. Then it also increases the secretions. So we also add anti-secretory agents like glycopyrrolate with ketamine. So we give ketamine with midas and glycopyrrolate. Okay? It will cause increase in everything. Now, since it is causing bronchodilation, it is a drug of choice in bronchial asthma. It can also be used for acute hypovolemic shock because it is causing increase in heart rate and BP. Then it is used in full stomach patients. In cyanotic CHT, remember, very important point. In cardiac tamponade and unstable patient, here ketamine will be the drug of choice because here BP is less in unstable patients and ketamine is causing a rise in BP. Then for short surgeries like burn dressing and field anesthesia, ketamine is the drug of choice. Where it is contraindicated in CAD, PIH, glaucoma, because it is increasing the pressures. Open eye surgery, head injury, brain surgery, right? Because again, it is causing increase in ICP. Then it causes good analgesia. So ketamine is drug of choice in bronchial asthma and cyanotic CHT. These two you need to remember. Okay, the next induction agent is methotrexate. It is an excitatory, it has excitatory symptom, right? It is a 1% solution and remember that it causes convulsions in small doses. Methotrexate, okay, it causes convulsion, and one thing that you need to remember with methotrexate is ECT. It is used in electroconvulsive therapy. It is contraindicated in neurosurgery because there is a history of epilepsy or in patients with history of epilepsy. Then these are the main drugs. Some other induction agents, okay, ये तीन you need to remember at any cost. What? Thiopentone, propofol and ketamine. ठीक है? Ketamine में sub increase, propofol में it's and thiopentone में it's decrease. That's all. Most of your questions will solve by itself if you remember the basic concepts. Okay, then let us move ahead. Etomidate. Okay, what do you need to remember with etomidate? It contains propylene glycol, very important. So there will be pain of injection and it has a rapid onset, right? And again, it is metabolized in liver and excreted by the kidneys. It causes myoclonic movement. This is very important. This is always asked. Okay. Then what else? It is the most cardiostable agent, hence it will be the drug of choice for cardiovascular and cerebrovascular surgeries. जहाँ पे भी vascular word आ जाए ना, like aneurysmal clipping, cardiovascular surgery, there the drug of choice will be etomidate, right? It causes maximum post-operative nausea and vomiting. ठीक है, what was antiemetic? The antiemetic was this one, Propofol, while others cause PONV, that is post-op nausea and vomiting. And maximum is due to etomidate. Then there is a new drug, carbitomidate. Okay. Next are opioids. Then remember, opioids, they will cause increased in ICP. Okay. They will cause neuroleptic analgesia and they cause decrease in heart rate and BP. Remember, there are only 3 that will cause increase in heart rate. First is meperidine, second is pethidine and third is pentazocine. मतलब क्या है, that opioids ये करेंगे decrease in heart rate overall, but there are exceptions. What is wrong with my spelling? Exceptions. What are the exceptions, right? So the exceptions are first pethidine, then pentazocine and meperidine. They will cause increase in heart rate. ठीक है, तो अब इनको क्लासीफाई कर लेते हैं बिकॉज ओपियोइड क्लासिफिकेशन इज़ वेरी इंपॉर्टेंट. रीड दिस फ्रॉम फार्मा. Opioids can be pure agonist, agonist antagonist and pure antagonist. Pure agonist examples are morphine, which is the prototype, and pethidine, right? And then some derivatives like heroin, codeine. Fentanyl is also an agonist, and remember that it causes wooden chest syndrome, and the chances of wooden chest syndrome, oh shit, it's not visible, sorry, and the chances of wooden chest syndrome are maximum with alfentanil, right? Then agonist antagonists are butorphanol, buprenorphine, ठीक है, ये याद कर लो. Then pentazocine, it is a partial agonist at mu receptors, right? Pure antagonists are naloxone, naltrexone and nalmefene. You should know these. This is very important. Read this from pharma. All right. So the opioid with shortest duration of action is alfentanil. It is remifentanil more than fentanyl. And since it is a short duration of action, it will be used in opioid it will be the opioid of choice in daycare surgery. Okay? In daycare surgery, the induction agent that is used is propofol. But if the question is asked that what is the opioid of choice in daycare surgery, then the answer will be remifentanil, right? Iske baad, what you need to remember is that the opioids, they causes respiratory depression, right? They release histamine, causes meiosis, that is the pinpoint pupil, constipation, nausea and vomiting. And with agonist antagonist, the one point that is very important to remember is that there is a ceiling effect on respiratory depression with the agonist and antagonist. All right. Then one question is neuroleptic anesthesia. What is neuroleptic anesthesia? When we use droperidol with fentanyl and N2O. Okay? And next, for these are the uses of opioid, obviously. First is neuroleptic anesthesia. Okay? Neuroleptic anesthesia, where we give droperidol with fentanyl and N2O. I'm so sorry for the noise. I think there's some construction going on in here. Then next is TIVA, that is totally intravenous anesthesia. We read it in propofol. So here we give remifentanil, the short acting, right, and propofol. Alfentanil can also be given. And next is sequential opioid anesthesia. It is given with pentazocine. Remember, these pure antags, they are used in opioid poisoning, except poisoning due to buprenorphine. Alright, so these are all the induction agents.